You may think you know what OCD is, but I promise you, you don't. Hi, I'm Dr. Roseann, and I'm a mental health trailblazer. Join me as we have real conversations about real solutions to kids' problems. And today we're going to be talking about OCD. It's actually the first in a series about obsessive compulsive disorder and how to help kids with OCD. So let's dive in. So most people think they know what OCD is. They think of somebody who's washing their hands, afraid of germs, and they think that's it, right? Many people have come to me and said, I don't have OCD. I'm not afraid of germs. That's because of good television, right? Or I should say television in general, right? I always think about the show Monk. If you've ever seen it, he had OCD. Howie Mandel suffers from OCD. He talks about it all the time. So obsessive compulsive disorder is different from anxiety. We're going to talk about that too at a later episode, but what is OCD? So we think of the compulsion components, right? So washing hands and checking and counting, that is real. But we don't talk about obsessions, right? And really at the core of OCD is fear. You have an irrational fear that if you don't complete an act, a thought, something bad's going to happen. That is really what OCD is. There's no rationalizing it. It doesn't make any sense. It doesn't have to have any form of reality based in it, right? But it's a fear. It's an irrational fear if you don't complete a thought, have a ritual, do a compulsion, that something bad is going to happen. And how does OCD develop, right? OCD develops at its nexus is some level of anxiety. There's a worried thought, there's a fear, and it's an irrational way of coping with fear. And just like one person has something healthy, you get up and work out, you use essential oils, you do meditation or neurofeedback, whatever it is, you do some deep breathing just to get through the stressors. This is what OCD happens, except it's maladaptive, is like we like to say. It's an unhealthy response. And I talk a lot about unhealthy response. Adults do a lot of things that are unhealthy, including, binge watching Netflix and drinking alcohol and a whole host of other things. But with OCD, the intrusive worries, right? Intrusive thinking, and compulsions are occurring an hour or more a day and interfering with your daily functioning. So it's got to show up at home, school, work. Kids can be masterful at disguising their OCD. We're going to talk about the symptoms and how it shows up. But there is a range of behaviors, right? So people say, I have a touch of OCD, right? Well, again, you don't have a touch of it. It's got to be interfering, right? And just because you're organized and clean doesn't mean you have OCD. You have to be afraid something bad is going to happen if you're not clean. If you're not organized, you're not putting things together. Do you hear the difference? So the way that this shows up with kids, the most common ways is that I see it with excessive questioning. So a need for reassurance, right? So mom, are we going to get there on time? Yes, we're going to get there on time. What time do you think we're going to get there? And what time is it? Are we going to get there on time? Should we have left yet? And it's really a lot of need of reassurance. Now, okay, happens once in a while, it's not OCD. If you're seeing a pattern, remember, we look for behavioral patterns across every issue. But if we're really seeing a pattern, we want to really look into that. And I think one of the greatest misunderstandings about OCD is it starts with intrusive thoughts. OCD has nothing to do with feelings. It is about uncomfortable sensations and uncomfortable, fearful, intrusive thinking. And when a good old therapist sits down and they misdiagnose OCD, which happens all the time, we're going to talk about that later, they start working on a feelings level. and it's like Chinese for somebody with OCD because it's their thoughts that have run amok. So what we really want to do is help to really understand what those obsessions are about. And we're going to talk about how to treat OCD in some later episodes in this series. I'm really dedicated to helping families with OCD, and many of my Pandas families have OCD. And this is, I'm going to tell you about OCD. You got to treat it. You got to put down the behavior. You got to stop accommodating it. We're going to dive into all that. But you cannot just get better from OCD. You really have to break the accommodation reinforcement cycle because parents inadvertently accommodate. So kids with OCD, they have a high need for reassurance. You might start to see some of those intrusive worries come up in different ways. So they might make comments like, about not wanting certain foods, and it came out of nowhere. Some of the most common types, particularly with PANS and PANDAS, is emetophobia, fear of throwing up. There's a lot of contamination fears but there's also things like scrupulosity, which is religious, intrusive thoughts. I mean, there's just so many things. OCD is dark, disturbing. The kids of all ages don't want to talk about it because it's embarrassing. Like, there could be anything from, if you're standing in a corner at 90 degrees, you're going to get pregnant, and the kid could be 9 years old. And they come out of nowhere and make no sense. Now, when you have the privilege that your kid is saying these things out loud, they are not crazy. This is OCD taking over their thinking. There's an intrusive thoughts that have run amok, and the OCD has taken over the brain. And there's a way to stop OCD from taking over the brain. It is very different from anxiety. Anxiety is rooted in something normal, something that actually happened. I shouldn't use the word normal. Something that happened. Like, I'm worried I'm going to do bad on this test because you have a history of doing bad on tests, right? Or you failed your last one, where OCD sort of just creeps up. Like, if I don't do this, my mother's going to die, right? These are very common worries that kids have. People fear of dying. And again, it could have started with anxiety, with something real, but then it becomes so hijacked. And then we inadvertently feed it by accommodating and telling kids it's going to be okay. We tell parents it's going to be okay, but we have to teach kids coping skills. So look for signs. They're repetitive questions. Also look for signs that they're getting you to participate in rituals, particularly around bedtime rituals, where they force you to do certain things to help them sleep. This happens a lot. Now, just because your kid is doing that doesn't mean they have OCD, but bedtime rituals, then with a pattern of seeing other things, a lot of anxiety throughout the day, could be a strong indicator of OCD. OCD is completely misunderstood. Medical and mental health professionals are literally inept at identifying it. You have to have specific training. It is so easy. And I, for like 15 years, improperly diagnosed OCD. And when you could, so easy in the early stages in particular to miss it, but also I was treating it with just talk therapy, cognitive behavioral, and you need to do exposure and response prevention. Which teaches you how to talk back to OCD. We're going to talk about that. So OCD, intrusive thoughts, compulsions, they are rooted in illogical fear. We are having intrusive thoughts and compulsions in an effort to avoid something bad from happening. It has to interfere with our daily functioning in order for it to be a clinical diagnosis. But one of the greatest mistakes I see people make with OCD is waiting too long to get treated, and it is very treatment resistant. But the good news is there are great treatments. I love doing neurofeedback combined with exposure and response prevention. I also love doing PEMF with ERP, and we will talk more about that. If your child has OCD, find a provider on IOCDF.